And we're back. Thank you so much for sticking around. My name is Lena Girl, and this is our public affairs show. We are talking story with some of our experts from Shriners Hospitals for Children, Honolulu. Now, we got the inside scoops from Mahealani and Angela about just, the incredible things that are happening in the community and how Shriners reaches out to the community. But now we get a chance to talk story about some of the things that are happening within the walls of Shriners Hospital. And we are right here sitting with an incredible woman that has been working with the company. Did you say 22 years with this organization?
Yes, 22 fabulous years.
That's fantastic. This is Andi Kubota. And Andi, exactly what is your title there? You're like the super boss nurse. Is that correct?
Well, I don't know if I'm the super boss nurse, but I do lead the efforts of patient care services. So my title is Director of Patient Care Services.
Director of
Chief
Patient
Nursing
Care.
Officer.
Awesome. So you actually have a medical degree as well. I mean, you have nursing background as well as now having to work relations. Is that correct?
Well, my background is in nursing and business.
Oh, okay.
Yes.
Awesome. So how does that work hand in hand?
Well, definitely our primary reason for being there is to take care of our kids. So you definitely need a clinical background for that. But at the same time, as a hospital, it's a business. So the combo really works well for us.
Absolutely. So give me a little history on Shriners Hospitals. I mean, how long has Shriners been helping our keiki here in Hawaii?
Well, we're really proud to say that this year is our 92nd year of being in Hawaii.
That's amazing.
So the Shriners system, there are 22 hospitals. And of the 22, we are second to open. Shreveport, Louisiana was the first. So we opened in 1923. So really proud of that.
Oh,
to
absolutely.
be able to deliver the mission that we do.
And, I imagine there have been some incredible modern developments through medicine and working with kids. Can you share some of them just within the 22 years that you've been there?
Okay, so I wasn't there, of course, when they first opened in 1920.
I would never assume that. That's terrible.
However, so when Shriners first started, they actually took care of children with polio.
Oh.
And eventually, polio was eradicated. So they looked at each other and said, well, what are we going to do next? And they delved into pediatric orthopedics. And that's what we do till today.
That's fantastic. Can you share some of your success stories? And I know that there's HIPAA laws and stuff like that, so no names and stuff like that. But can you share some of the stories that have come past your desk or that you've been able to work on that have just been incredible?
So many. The stories that give me chicken skin are the ones that just excite me. But the one that stands out is a little girl that we brought here from American Samoa, and she couldn't walk. In order for her to go to school, when she did, she hardly went to school too. Her mother had to carry her on her back.
Huh?
And so she was born without part of her tibia, her lower leg bone. And so she came here, and I forgot to mention that we do have medical teams that go out to the Pacific. So one of our teams went out, found this little girl, arranged to bring her back to Hawaii. We did the surgery. Of course, it wasn't just one surgery.
Oh, yeah.
It was
That's
many.
Multiples, right?
Right. A series of surgeries. And by the end of that year, she'd been here a year, she was walking. And those are the kind of things that we feel so good about. And we can be part of changing that child's life and making them more functional.
Absolutely.
And that happens pretty much every day. But this little girl really stood out because she went from living that way for 7 years, and then our team finding her and her mother crying, so happy. And we celebrated her birthday here, and just so many milestones for her when she was in Hawaii that it just really huge impact to me.
So Shriners Hospitals for Children Honolulu doesn't just serve Honolulu, doesn't just serve the state of Hawaii. We serve the entire Pacific. Is that correct?
That's correct. Our service area is larger than the continent USA. So, of course, our largest population of children we serve are from Hawaii. So that includes not only Oahu, but our neighbor islands. And then we do have teams that go out to the Pacific Rim that you mentioned. So I did mention American Samoa, and then we have Samoa, Fiji, Palau, Guam, Saipan, Ponape. So really, it's amazing. It's amazing what we do.
Right. I'm talking story with Andi Kubota. She's our chief nurse officer and also works with, I'm so sorry, what was your second title?
Director of Patient Care Services.
Director of Patient Care Services. So that's two hats you're wearing.
Well, because we are a smaller hospital. However, aside from nursing, I also oversee any other clinical department. So it could be rehab services, where we have physical therapy and occupational therapy, and pharmacy, because we have to provide medication to our children, nutritional services to provide appropriate nutrition to our children, recreational therapy, case management, also known as care management, and outpatient services, radiology. So there's a number of services within our walls at Shriners that we can provide so that we have the best outcomes for our children.
That's fantastic. So I was right. You are the boss lady. You are. You are. You're taking. No, I know we're going to be meeting some of the doctors.
Maybe it's bossy. I don't know. Bossy.
You are the bossy lady there. Shriners Hospitals for Children, Honolulu. I'm getting a chance to spend time with their team, and we're going to be talking story with more of them. Dr. Fedoric is going to be stepping in just a little bit, and he's one of our medical experts there. When you, for someone being there for 22 years and having to work with these doctors that are new, coming in, what is the one thing that you share with them that might be different from any other place that they've come to? You know, being in Hawaii and them coming maybe straight out of, off their degree programs, off their field experiences in other places.
Well, not to offend anybody, but our emphasis in caring and our mission of providing the services that we do, regardless of the family's ability to pay, is really the nucleus of what we do. And so that drives us.
Absolutely.
The first line is not whether the child is insured or not. If they're insured, that's great. If they're not, we still provide the service if we can. And our emphasis is pediatric orthopedics. So if we can do that, we will. And that's what makes it so wonderful.
And I think that's what makes it less stressful for the families. I mean, do you notice that it's a little bit different? 22 years in Shriners Hospital, you've worked in other medical facilities before?
Yes.
That are insurance driven?
Yes.
And do you see that culture is a little bit different in regards to a parent coming in and having to worry, I know my child is sick and I know my child needs this, but I can't afford to pay.
Right.
And being able to come to Shriners Hospital and understand I don't have to worry about that. I can just concentrate on my child getting better.
Exactly. And that's what makes us different, I feel. I don't mean to sound biased, but it truly is that piece that we can reassure our families that shouldn't be their primary worry. They should be concentrating on their child and what can we do to help your child?
And
that makes it wonderful.
Has that changed how you deal with families and how you come to work and waking up in the morning? A little bit different from when you used to work in other facilities?
Yes. I can't say I wake up with a smile every morning, but it sure makes a difference. It sure
Thank you for not being a big liar.
Less stress, put it that way. Yes.
Absolutely. We're talking story with our chief nurse officer, Andi Kubota. Now, Andi, when it comes to the community and what you see the community's potential can be to assist Shriners Hospital in your mission, what is something that you would like our community to be able to do? You right now, you have moms, dads, you have families listening in right now. Mm-hmm. And you essentially have a captive audience. What is it that you can share with them that would make all the difference to you in this year and in the years to come that they can give to Shriners Hospital?
Well, it's really about serving the children. And so if your listeners out there know of someone, have a relative or a loved one, friend, that they think would benefit from our services. And again, that's pediatric orthopedics. And we recently have started our neurodevelopmental clinic as well, to please refer. And, I always tell families, if you're not sure, just call us up and we can see that child and we can do that assessment to determine, yes, we can help that child or not.
Absolutely.
And so we don't expect the families to figure that out, but call us up and we can talk over the phone or bring your child in and we can do that assessment. Additionally, we started our fracture clinic, and what that is, it's a walk-in fracture clinic Monday through Friday, excluding the weekends and holidays, where anyone, you don't need to be a patient of Shriners, can walk in And like I said, it's a fracture clinic, but if it doesn't even have to be necessarily a fracture, but it could be a suspected fracture, a sprain, or anything somewhat related. Come on in, and from 7:30 to 9, no appointment necessary. And your child, as long as they're not 18 yet, we will take a look at that child, and hopefully we're able to help.
That's incredible. Okay, now Andy has been saying, just call. Here's that number, 808-941-4466. That's 941-4466. For more information, you can always hit up their website, shrinershonolulu.org. Shriners Hospitals for Children, Honolulu. We're talking story with Chief Nurse Officer Andi Kubota. She's going to be hanging with us for a little bit to talk a little bit more story and to join our doctors as we find out more about the great work that Shriners Hospitals does here in Hawaii, through the Pacific, and through the nation.